Hi, I'm Julie McIntosh, Director of Education at Compassion Care Hospice. We know if you're looking in a hospice for yourself or a loved one, you probably have many questions. In this video, we're going to talk about some of the many misconceptions surrounding hospice care. There's many of them, but we're going to touch on a few of the most common. Hospice is one of the most misunderstood and underutilized of all healthcare benefits, not just amongst the public, but amongst healthcare professionals as well. Because we don't like to talk about our mortality in society, we see a lot of fear and confusion surrounding this important healthcare benefit. It's essential to understand hospice as an end-of-life option so you can make informed decisions for yourself or a loved one when the time comes. So let's start with, hospice is a place you go to pass away. Hospice isn't actually a place at all. It's a concept of care focused on palliative care or comfort care, managing symptoms, and improving quality of life. Hospice is a service rather than a place you go. It's provided wherever a person calls home. This may include living in a private home, assisted living, skilled nursing facility, or group home setting. Hospice nurses and other healthcare professionals provide support and are available 24 hours per day. Hospice patients must be bedridden to qualify for hospice. While those with a life-limiting illness may struggle to do some of the things they once did, hospice is founded on the idea that with proper pain and symptom management, patients can enjoy a much better quality of life. Hospice patients are encouraged to do the things they most enjoy and desire, things like spending time with friends, going to dinner or a show, even traveling. Hospice encourages our patients to fulfill their bucket list items and do the things that are most important to them. The next is hospice care ends after 6 months. This misconception comes from Medicare's guidelines, which state a hospice patient must have a limited life expectancy of 6 months or less if the disease follows its normal course. However, with hospice support and care services, people may live well beyond this expectation. Patients can continue to receive hospice services indefinitely as long as they continue to meet criteria. Patients are assessed at regular intervals to determine continued eligibility, and we often see patients receiving hospice support for far longer than 6 months. Next is hospice is only for people with cancer. While we certainly see patients with end-stage cancer, this is only one of the many diagnoses that we see in hospice. Medicare guidelines state there are no disease restrictions in determining hospice eligibility. This means that any disease or combination of diseases that are in the terminal stage and limit the patient's life expectancy may qualify for hospice. Other common end-stage diagnoses we see are COPD and other lung diseases, heart disease, kidney disease, Parkinson's, Alzheimer's, and related dementias, just to name a few. Next, hospice patients can't resume traditional health care. Hospice is a choice, and patients who choose hospice can stop at any time for any reason and resume traditional health care. This may be to resume aggressive or curative treatments, such as chemotherapy. Hospice is also not a one-time benefit, so if a patient wants to resume hospice later, they can do so as long as they meet criteria. There is no limit to the number of times a patient can receive hospice support in their lifetime. Next, hospice patients only receive pain medication. All other medications are stopped. Any medication that's medically necessary for the patient is continued, as well as medications for pain or other symptom management, like respiratory distress or anxiety and agitation. While hospice care focuses on palliative or comfort care, it's holistic in nature, meaning we're concerned with the whole patient, not just the disease that led them to hospice. Our primary goal is to keep the patient as comfortable as possible, allowing them to focus on the things that are most important to them. If you have more questions about hospice and how it can help you or a loved one, please reach out to any of the hospices listed here on Vegas Healthcare, and we'd be happy to answer your questions.